kind of a combination. I knew I wanted to do pediatrics. I've always liked children and families. I knew I wanted to do that. And I'll go back to that in just a minute. But I always thought I would specialize in genetics, and I had a change of heart after I started having a family. So the reason I first became interested in pediatrics is that my father is a pediatrician in a rural area. So when I was about 6 years old, there was a public health movement to get physicians to move to rural areas. And so we moved to southern Ohio, which was truly Appalachia. And that is where my dad practiced medicine.
Okay.
And as a kid, what I remember the most was he worked really hard. He had long hours, but he loved what he did, and he was so appreciated. And I thought it must feel so nice to really help someone and know that you've done that and then get the positive feedback for it. So that's when I first thought about being a physician. I've always loved science. I knew I would go into science. And so I went to Duke and became pre-med. I also studied zoology because I really enjoy natural science as well. And I had to make a career decision after I graduated. I did it all. I had an idea, but I wanted to make sure I was really committed because financially I was on my own and just the timeline. And the other things I considered marine biology, and I considered being a naturalist. And I think I would have loved both of those. But I ended up selecting medicine, and I don't have any regrets. It's been a good decision. Well, I graduated from Duke, and I actually worked for a few years before I went to med school, which is pretty common now, but it wasn't so common then. And I just wanted to be 100% sure because I was a little nervous about the time commitment and the finances. So I became a resident of North Carolina. And at the time, it was just very affordable. I didn't feel so flustered about having to pay off my dad. I have friends that have gone to private schools, like, I mean, they're still paying off. Yeah. We did the match process, and I matched with Children's Boston, and I loved it. I mean, the hours were really long. At that time, there wasn't a cap on hours. A typical week was 100 hours a week. You are paid a salary, but if you think about what your hourly wage is, it is not very much. It was so interesting, and I think one of the things that was interesting about it is you see such unusual things. In private practice, which I am now, I see what life is like. It's the daily life, and it's what my life is like at home, and probably what your life is like. But there, it was, somebody from Saudi Arabia that had been bitten by a tsetse fly, or just, renal failure in a 2-year-old, or unfortunately, lots of cancers. Many of the kids were very sick, genetic syndromes, all kinds of things. It was very unusual medicine. So basically, I trained on zebras instead of horses. But it is a good way to learn. I think the number one type of child I learned from, and this is kind of really hits your heart, were kids we called an MRCP, which would be developmentally disabled and cerebral palsy. And these were kids that had pretty bad brain damage, often from a birth injury or something like that. And they just had so many medical problems. They were in the hospital all the time. And they taught me my medicine. That's how I learned. I'm really visual, and I love art. And before dermatology became kind of a cosmetic field, I think I would have loved it because I like to identify rashes and things like that. Mm-hmm. And gosh, my weekends would have been better. But I didn't. I didn't even do dermatology till after I decided on pediatrics. I rotated through it, and I thought, gosh, I wish I'd done this sooner. But I don't really have any regrets. Okay, so we are a group of now 7 pediatricians, and full-time is 4 days a week. And a full day is usually about 10 hours. Just because of charting and things like that, maybe a little bit longer. A lot of that I can do at home. So I'm working 3 days now, so I have decreased my hours a little bit. We are on every 7th weekend. We worked evenings every Monday. And basically, we're open 365 days a year, every holiday, every snowstorm, because kids get sick. During residency, you're learning so much, and you're changing what you're doing every 4 to 6 weeks. Even though it was hard, it was so intellectually interesting that I didn't really get burned out. I did drink a lot of coffee. And I did go through burnout, which is one of the reasons I dropped down to 3 days, is just the pace of my work. It could be harder. It's not like the ER where people are dying, but it is constant. But I did get a little burnout, and partly, like I said, it's the constant routine again and again and again, and the long hours. That was hard. But now that I'm 3 days, I have Tuesday and Thursday off. I can work as hard as I need to Monday, Wednesday, Friday, and I'm off. It's okay. It works out well. I can make some general statements, knowing that there are going to be exceptions to all of them. In general, you have to be patient. And that's not my biggest strength, but I can do it for a period of time. And I'll give you an example. New parents, they just have so many questions. I get called about everything. Why is he sleeping? Why is he going to the bathroom more? Why is it this color? But you get him through that. And I had one family that had a little boy. He was born a little bit premature, so he was pretty small. We had to fall in for his weight. He grew up. He's graduated college now. And they had their second child, and they came in and they said, we just want to tell you how sorry we are for all the questions we have. And I was like, that's hard. It is interesting because over probably a couple of generations, we've gone from the art of medicine to follow these protocols. So it's a little bit more regimented. And I think in the end that does provide better care, but I definitely like to do my own thing a little bit. So I kind of, sometimes I do my own thing. But it's interesting to see that it's becoming a little bit more, I don't even want to say generic, but mechanical, maybe, like choice of drugs. I'll give you an example. The treatment of chlamydia was 1 dose of azithromycin. Okay. Now it's 7 days, twice a day of doxycycline. What do you think is going to be more successful in a teenager? I think 1 day. So that's like an example of something where I choose the second tier of meds because I think I'm going to get more success, and they don't usually come in for follow-up with cure. So let's see, what else would the CME is not that hard to keep up with, but a little bit hard. And they changed it a few years ago. You could take the exam with your book, and that was great. So it's gone from every 7 years to every 10 years, but there's also an option of just doing these questions on a regular basis. And if you can keep up with those, you can hopefully not have to do the exam. I'll know that in about 3 years. That's a tough one. I think this one doesn't bother me, but it does bother some people. I think pediatricians are a little bit less respected. I don't know why, but I can give you an example. One of my colleagues' parents called her for her own personal medical advice because she didn't want to wake up her doctor. And that may just be because we have a much more personal relationship. Everybody, the whole family. It's ugly truths. The hours are kind of long. The weekends are long. Overall, it's a really rewarding, fun field. So when you're in residency and you do all these unusual cases and you learn everything, and then you go in private practice, and it's really different. And you're not seeing the zebras anymore; you're seeing the horses. But you also do a ton of behavioral health, which I think now there's more training in. But when I was there was minimal training. 30% of what I do is anxiety, ADD, school problems, all that kind of stuff. And those are harder, longer-term problems. And although they're probably not my first interest, I do a lot of them, and I've gotten better at it, and I really am happy I can help people through them. But it was a real change of pace, and sometimes those can be very tiresome, emotionally draining cases. It's so much worse, and there's a real shortage in counselors for people, and that's been hard. The pandemic was tough. And especially for an adolescent who's part of growing up as a teen is, your social group, and getting out and getting contact, and that gets cut off, and all these things happen. But the numbers have increased definitely for anxiety and depression, not for ADD so much. I can't comment truthfully on drug use. I'm not sure if that's gone up, but I suspect it has, and it's just been undercut by the pandemic. I did hear that overdoses are up. We also do a good bit of drug use. We have a good program at Children's now that we hook up families with for drug use, and I've been using that a little bit more. Oh my gosh, so different. And I'll come up with another point too. So when you're in the hospital, you are on your toes, well, it was 36 hours. I think it's 24 now. But and it's just, everything's just a lot faster. Things are often more urgent. And as a resident, you do a lot of things like going to get blood draws and blood gases and whatever. It's just on the go all the time. It's a little bit more paced where I am, and there's an end to every day. Medicine has changed a lot since I finished my residency. There were some hospitalists when I was finishing my residency program, but not that many. So I would round every morning at the hospital. I would go to the nursery and to the pediatric ward. And pretty soon, the neonatologist and the hospitalist took over the nursery, and then the pediatric ward, and I haven't rounded in 12 years. And that has given me about an hour and a half more every morning. But there are probably 3 things I do. I love reading, and I love audiobooks, and I do them all the time. I always will do a science book and then a historical fiction book. And I just finished a couple, so I'm looking for some today to start some new ones. I paint and draw. I always did a lot when I was in grade school and high school, and my second major in school was studio art. But once I decided on the medicine track, that just got put on hold. I have two kids that are both grown. And once they left for college, I really started doing a lot more. So I do a lot of painting and drawing and collage. I'm doing a painting certificate and a natural science illustration certificate at Rhode Island College of Design. That should finish soon, and I'm hoping to go to art school. Let's see what else. Fitness is a big part of my life for two reasons. One, I think it's important to stay healthy because you feel better, but also it's a good stress reliever. So I try to be really good about that. I'm not running marathons or anything like that, but I try to walk or do spin or something almost every day. So that's my other thing I do. I do love to travel, and I like to do kind of exotic cultural stuff. I like to learn about other cultures. I like to see animals and nature. So I just try to put it in my schedule, and I just schedule it really far ahead of time. So, for example, I'm going to Chile and Argentina in February, and we're going to go on a puma scout. I try to plan it ahead. We did one really cool trip where we went to Mexico and we hiked up to where the butterflies migrate, the monarchs. So I like to do funky trips like that. You got to just squeeze it in and schedule it ahead of time. I probably get 6 weeks off a year now. Maybe not quite that much, but it probably, well, maybe it's closer to 4, but it's plenty, and we help each other out. I will tell you, when someone's on vacation, it's really hard on everyone else. That's the part I don't like about my job, is I feel a little guilty when I take time off, and I know everybody's covering for me. Yeah. So I was born there. I spent all my summers there, but after age 5, I moved to Ohio, and I was there until I was 18, and then I went back to North Carolina and Washington, D.C., and then North Carolina. And I've lived here longer than I've lived anywhere else. Southern North Carolina is better. I haven't had too much of an issue integrating. I do know that when I retire, I will not be in here in February and March. I do think when you're in medicine, your partner will have a little bit more, will need to be more involved in daily family things. So, instead of from the 1950s when the woman was home and the man worked, not so much anymore. I think my husband had to do a little bit more of the child rearing than I did as a resident, for sure. Mm-hmm. And then we've been pretty 50-50 since then.
Especially in the pediatric field.
I think what makes me nervous is just how specialized we're becoming. I just feel like I don't want to say fragmenting, but branching out so that it's really hard to have a sense of everything that's going on. So I've got development down. I've got all the day-to-day stuff down, no problem, which is probably 95% of medicine. But anything esoteric, I feel like I don't know. That is time away, but the other part is just the rapidity of research and our technological advances. I had somebody come in the other day. She has a rare disorder. She has narcolepsy. You hear about it a lot, but you don't see it a lot. And she started talking about this medicine she's on, and I just had to say, I don't know what you're talking about. I've never even heard of this thing. And it turned out she has to take, so when you have narcolepsy, you fall asleep very easily, but you also have problems having good sleep. So you have to take really high doses of stimulant medicine, but then you have to take sedatives at night. And I'm sorry I can't remember the name of the drug, but it was essentially, and excuse my language, it's a date rape drug. She takes that every night to sleep. So yeah, so I was like, okay, well, tell me about this, and where can I find out about it? And let me know if you need some more. The continuing medical education helps because there's something called Question of the Week by the American Board of Pediatrics, and they're not too difficult, but they have all different topics. So the two I did most recently were about same-sex couples and some of the stresses they have raising kids. So they'll throw out all kinds of different topics, and that helps for sure. And I have to have a certain number of credits in order to keep going. But that is a little different because that is learning from text and well, it was a sad day that I actually threw my textbooks away. Everything's online now. It's funny. You just kind of switch from doing books and you become online, and things are updated all the time. Sometimes it's hard to stay current. I may not know all the new antibiotics that are out. I have a regimen of this that I use, and every now and then a new one slips in. I think, oh my gosh, what's this? I got to learn this one. I look up things all the time. If I don't know the answer, there's something called Up to Date. Just look up something. Okay, that's prophylaxis for tick bites. When can I give this dose of medicine? All that kind of stuff. I just look it up every day, and you get to see me. That's a really good question. I'm trying to think, would it be easier if it were round for the typical person to get up and down, but everybody's body type is so different, that wouldn't be it. We're certainly more circular from above than we are square or rectangular. I can't answer that question. I don't know. Well, I used to love the ginkgo tree because because it's a little bit exotic. I love the shape of the leaf. But this fall, I figured out that it has the stinkiest fruit. I do like holly trees, especially the females, because they have these bright green leaves year round, and they have these beautiful red berries. Joshua tree, maybe a Joshua tree.
There you
Although
go.
you would live in a very harsh environment.
Yes.